We're hearing so much about Zika virus right now because not only is it in the news, but it's a significant finding, and it's very prevalent in a lot of our population, and there's significant fear that this is only the beginning of the epidemic. Zika infection has been around in different parts of the world for many, many years. It only came to the Western Hemisphere about a year and a half ago, and only in the last few months has it become an epidemic proportion in patients that are presenting to the United States. It's gotten very common in Brazil, and we have a lot of patients that are emigrating to the United States who have been infected in other places. The type of virus that Zika virus is called the flavivirus, and it's very similar to other types of infections that we're familiar with, dengue fever, West Nile. These are very typically mosquito-borne vectors where mosquitoes transmit from patient to patient. There is transmission through sexual contact. There is virus present in breast milk, although no transmission has been documented. So there's a lot of similarity between the Zika virus and other viruses and other infections that we've come into contact with in many years in the past. So what's happened is there's a lot of circumstantial evidence between microcephaly and different types of fetal outcomes to Zika virus has progressively become more proven. So up until very recently, we would see patients who had Zika virus had a higher incidence of complications, specifically microcephaly, which is what's in the news most of the time. And now what we're seeing is that documented Zika virus in the tissue of newborns that are diagnosed with microcephaly. So we're seeing a direct one-to-one correlation rather than a circumstantial association. As of today, we are seeing moms who come to this country with Zika virus from other places. There have been babies that have been born in the United States with microcephaly from Zika virus. And as we get into the warmer months, we're seeing that from Latin America, from South America, now we're going into Puerto Rico, South Florida, Hawaii. And as the weather continues to warm, we're going to see it increase up until really the northern states as high north as New York. So whenever we are dealing with pregnant women or women who are interested in becoming pregnant and their concerns about Zika virus, the most important thing is avoidance of being in an endemic area. So by eliminating this risk factor, we can really minimize the risk of the mom and the baby becoming exposed to the Zika virus. Sexual contact is a mode of transmission, and for that reason, when you have a spouse or a partner that has been exposed to Zika virus or has an active infection, unprotected sexual intercourse is a mode of transmission and should be avoided. So the recommendation for Zika virus as it currently stands is we screen every patient for recent travel to an endemic area. The four main categories of symptoms of Zika virus infection is low-grade fever, rash, conjunctivitis, and joint pain. The presence of two of these symptoms and endemic travel puts the patient at risk, and then we can go forward with some sort of diagnostic testing. So if you are planning any travel, even if it's not currently a recommended not to go to area, before traveling I would recommend you recheck with your physician or the Department of Health. Not all mosquitoes carry Zika. There are several species that carry Zika more frequently than others. Unfortunately, those species are what's historically been endemic to Long Island. So if somebody has active Zika virus, documented Zika virus infection, the recommendation is to wait 8 to 10 weeks before trying to get pregnant. The recommendations that we give to all women as the mosquito season starts to become upon us is to do everything you normally would do to avoid mosquito bites. So avoid standing water, long sleeve clothes, mosquito repellent, anything that you would normally do to avoid mosquito bites in the season is the same precautions that we give people now. Pregnant women are not at an increased risk for getting Zika virus, and Zika virus is not itself more serious in a pregnant patient. The symptoms are very mild and self-limited, but we want to make sure that pregnant women do not get any more exposure than they need to. The microcephaly risk is primarily when you get exposed and contract the virus in the first and second trimester. When you contract the virus towards the end of the pregnancy, the baby has already formed most of its neurons, and therefore the main concern at that time has to do with fetal well-being and the vertical transmission that we sometimes see with the baby being born with a rash. There is an increased risk of poor outcome, not just microcephaly, and to that end, any confirmed Zika virus will need increased monitoring, both with ultrasound and frequent doctor visits.